Malarone contains two medicines, atovaquone and proguanil, and is used to prevent and treat malaria caused by mosquito bites in countries where malaria is common. It works by killing the malaria parasites living inside red blood cells and other tissues. In some cases, another medication like primaquine may be needed to complete the treatment. Both medications may be necessary for a complete cure and to prevent the return of infection. The United States Centers for Disease Control provide updated guidelines and travel recommendations for the prevention and treatment of malaria in different parts of the world. It is important to discuss the most recent information with your doctor before traveling to areas where malaria occurs. Make sure to read the patient information leaflet provided by your pharmacist before you start taking Malarone, and each time you get a refill. Take this medication by mouth with food or a milky drink that contains fat. If you vomit within 1 hour of taking a dose, repeat the dose, and contact a doctor if the vomiting doesn't stop. Swallow the tablet whole and do not chew it. If you have trouble swallowing tablets, this medication may be crushed and mixed with condensed milk. The dosage is based on your medical condition and your response to treatment. To prevent illness, take Malarone as directed by your doctor, usually once daily, and continue taking the medication while in the area and for 7 days after leaving. If needed, additional medication can be taken for 14 days. To treat malaria, take this medication as directed by your doctor, usually once daily for 3 days. It is very important to continue taking this medication exactly as prescribed by your doctor, and to prevent mosquito bites. No drug treatment is completely effective in preventing malaria, so seek medical help right away if you develop symptoms of malaria. Some common side effects of Malarone may include nausea, vomiting, abdominal pain, headache, diarrhea, weakness, loss of appetite, or dizziness. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to inform your doctor immediately if you experience any serious side effects, such as signs of liver problems, anemia, or severe infection. Additionally, while a severe allergic reaction to this drug is rare, it's important to seek medical help if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. And remember, this is not a complete list of possible side effects. If you notice any other effects that are not listed, be sure to contact your doctor or pharmacist for further guidance. Before taking Malarone, make sure to let your doctor or pharmacist know if you are allergic to atovaquone or proguanil, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. Before using Malarone, it's important to tell your doctor or pharmacist about your medical history, especially if you currently have diarrhea, vomiting, kidney problems, liver problems, mental/mood problems, or seizures. This medication may make you dizzy, and using alcohol or marijuana, cannabis, can make you even more dizzy. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do it safely. It's also recommended to limit alcoholic beverages, and to talk to your doctor if you are using marijuana, cannabis. Before having surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used when clearly needed, as traveling to an area with malaria while pregnant puts you and your baby at a much higher risk for complications. It's important to discuss the risks and benefits of malaria prevention with your doctor. It is not known if atovaquone passes into breast milk, but the proguanil in this medication does pass into breast milk, and the effects on a nursing infant are not known. The CDC recommends against using this product for malaria prevention if you are breastfeeding an infant weighing less than 11 pounds, 5 kilograms, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Malarone. This medication may interact with other drugs and herbal products, which can affect how Malarone works in your body. Some products that may interact with Malarone include penicillamine, blood thinners such as warfarin and metoclopramide. Additionally, other medications like efavirenz, rifampin, rifabutin, and tetracycline can affect the removal of Malarone from your body, potentially impacting its effectiveness. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist to ensure the safe and effective use of Malarone. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. If someone takes too much Malarone and experiences symptoms like passing out or difficulty breathing, it is important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. It is important not to share Malarone with others, as it is prescribed specifically for your condition. Your doctor may also request lab tests to monitor your blood cell counts and liver function while you are taking this medication. Make sure to attend all scheduled medical and lab appointments, and consult your doctor for more information regarding these tests. If you forget to take a dose of Malarone, take it as soon as you remember. If it's close to the time for your next dose, then just skip the missed dose and take the next one at your regular time. Remember not to take a double dose to make up for the missed one. It's important to take your medication consistently to ensure its effectiveness. It's important to store Malarone at room temperature, away from light and moisture. Make sure to keep it in a safe place and out of reach of children and pets. Do not flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. When the medication is expired or no longer needed, be sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.